The SENOMAC Trial. Welcome to the Everything Surgery podcast. Today, we are presenting a comprehensive and formal summary of the SENOMAC Trial, a major ongoing study in the field of breast cancer surgery. The SENOMAC Trial, which stands for Sentinel Node Only versus Major Axillary Clearance in Breast Cancer with Sentinel Node Macrometastasis, is designed as a prospective, randomized, controlled, non-inferiority trial. The main aim of this investigation is to determine whether omitting a full axillary lymph node dissection is as safe as performing one for breast cancer patients who have limited spread, specifically 1 or 2 metastases, to the sentinel lymph nodes. This study is primarily taking place in Sweden and Denmark, along with other participating sites. It has enrolled more than 2,500 women diagnosed with early-stage, operable breast cancer. All participants had 1 or 2 sentinel lymph nodes containing macrometastasis, which are tumor deposits larger than 2 mm. The majority of these patients received contemporary, standard adjuvant therapy, including chemotherapy, endocrine therapy, and radiotherapy, following national guidelines. In terms of interventions, the SENOMAC trial compares 2 groups. The intervention group underwent only a sentinel lymph node biopsy, without further surgical dissection of the armpit. In contrast, the control group followed the conventional approach, receiving a completion axillary lymph node dissection, which involves the removal of all lymph nodes in the axilla. The central hypothesis of the SENOMAC trial is that for this specific group of patients, axillary lymph node dissection is an unnecessary procedure. This is based on the effectiveness of modern systemic therapies, such as chemotherapy and hormone therapy, which are capable of treating micrometastatic disease throughout the body. Additionally, adjuvant radiotherapy plays a significant role in controlling any residual disease in the axilla, potentially making the added morbidity associated with a full axillary lymph node dissection unwarranted. The primary endpoint of the trial is overall survival at 5 and 10 years, providing a critical measure of whether the less invasive approach is as safe in the long term. Secondary endpoints include breast cancer-specific survival, disease-free survival, arm morbidity such as lymphedema, pain, and sensory loss, as well as measures of quality of life. Currently, patient enrollment is complete, and the trial is in its long-term follow-up phase. The final results are eagerly awaited and are anticipated to be released in the coming years. However, even at this stage, the SENOMAC trial has already started to influence clinical practice in Scandinavia. Omitting axillary lymph node dissection in selected patients has become increasingly common, and the trial is widely regarded as pivotal. Its outcome could help solidify a significant shift towards less invasive breast cancer surgery worldwide. The importance of the SENOMAC trial lies in its foundation on previous studies, such as ACASOG Z0011 and AMARIS, which also questioned the necessity of axillary lymph node dissection. However, SENOMAC stands out because it includes patients who have received modern chemotherapy and specifically involves those with 2 positive sentinel nodes, a group not fully addressed by previous trials. Furthermore, with overall survival as its primary endpoint, SENOMAC promises to provide the highest level of evidence yet. In summary, the SENOMAC trial will ultimately clarify whether a major source of surgical morbidity for breast cancer patients can be safely eliminated for a large population of women. We look forward to bringing you the definitive results as they become available. Thank you for joining us on the Everything Surgery podcast. If you find our content informative, please like, share, and subscribe. Stay tuned for more deep dives into the extraordinary world of surgery.